Welcome to Rural Funds Management. This training module provides information on the RFM drug and alcohol policy and provides some general information about drugs and alcohol. At RFM, we are committed to the well-being of our employees, particularly when it relates to their ability to perform their work in a manner which does not jeopardise their own safety or the safety of others. This drug and alcohol training module discusses the risks of alcohol or drug misuse, which might have a detrimental effect on health, safety, or productivity. Employees should not be under the influence of alcohol or drugs while at work for RFM. Workers are not permitted to work when they are under the influence of alcohol, any illegal drug, or taking prescription or non-prescription drugs which may affect work performance. You are not to come to work with alcohol or drugs in your system. If you are using drugs or medication, check with your doctor or manager to ensure they do not affect your ability to work. Your job depends on you being responsible with drugs and alcohol. Drugs that can affect you at work and we test for include alcohol, cannabis, amphetamines, methamphetamines, opiates, benzodiazepines, and cocaine. In small amounts, alcohol gives people a feeling of well-being. In moderation, it is generally not harmful. Regular excessive drinking can place someone at a higher risk of injury. Alcohol is a positive part of life for many people, and most of the time drinking alcohol doesn't cause any problems. But drinking too much or at the wrong time can be harmful. The liver can eliminate alcohol at a rate of about 1 standard drink per hour. Nothing will speed this up. Not black coffee, not exercise, not cold showers. Cannabis is the most widely used illicit drug in Australia. It is a depressant and a hallucinogen, and it includes marijuana, hashish, and hashish oil. The risks of cannabis use can increase when combined with other drugs such as alcohol. The effects often intensify in unpredictable ways. Regular smoking of cannabis increases the risk of bronchitis, lung cancer, and respiratory diseases associated with smoking. Cannabis contains twice as many cancer-causing agents as the same amount of tobacco. Amphetamines are a class of drug also commonly known as speed. It is a synthetic stimulant used to suppress the appetite, to control weight, and to treat disorders like narcolepsy and ADHD. Amphetamines cover several similar substances, including amphetamine sulfate, methamphetamine, and dexamphetamine. Opiates are derivatives of constituents found in opium, which is processed from the sap of the opium poppy. Substances derived from the opium poppy include morphine, heroin, and codeine. Benzodiazepines are tranquilizers prescribed to help with sleep or anxiety problems. Brand names you may have heard of are Valium, Seropax, and Rohypnol. Cocaine is a stimulant that speeds up the workings of the brain. This illegal drug is processed with a blend of other chemicals to form a white powder known as cocaine hydrochloride. RFM's drug and alcohol policy allows for pre-employment, random and for-cause drug and alcohol testing. The main objective of drug and alcohol testing includes improved workplace safety and improved productivity. Employees may be requested to provide a breath or oral fluid sample where they have been directly or indirectly involved in an accident or incident in the workplace, or if they display any behaviour or action which may cause a supervisor or manager to reasonably suspect that the employee has breached the policy. They may also be tested at the commencement of their employment or randomly during employment. If you are taking over-the-counter or prescription medication, this is not in itself a concern to RFM. However, it becomes relevant when the medication affects job performance or safe work practices. If an employee is unsure about the effects of over-the-counter medication or drugs, they should consult a doctor or pharmacist about the effects. Drugs and alcohol remain in your system for a period of time. Alcohol can remain in your system for up to 1 day. Cannabis can remain in your system for between 2 days and 46 days. Amphetamines remain in your system for between 2 days and 7 days. Opiates remain in your system for up to 3 days. Benzodiazepines remain in your system for between 3 days and 6 weeks. Cocaine remains in your system for between 2 days and 22 days. It is possible that some medications may lead to a false positive result. You should advise the tester at the time of testing if you are taking any medications. Oral drug testing with the drug wipe device will identify cannabis consumed in the last 4 to 6 hours, cocaine, crack cocaine, opiates including heroin and morphine, amphetamines including methamphetamines, and benzodiazepines, all consumed within the last 12 to 24 hours. The breathalyzer test will identify your blood alcohol level in the same way that a roadside breath test would. A positive result will always be verified by a second test, in the case of drugs through a pathology laboratory. Each case will be assessed on a case-by-case basis following medical advice. A serious breach or continual breaches may warrant dismissal. RFM has engaged the services of a fully qualified employment assistance program provider to provide employees with counselling, advice, and rehabilitation for drug or alcohol-related difficulties. Referral to a medical practitioner may also be arranged. Thank you for completing this training module.